These are the wards that we have. This is actually the women's ward, but they're all very similar. As you can see, it's made up of antiquated beds. You can see the mosquito nets that are hanging over each of the beds. A very common thing that you'll see there. And it's also open to the environment, as you can see from the door at the end. Thankfully, we didn't get too many monkeys running around. I was just going to tell you really quickly about two patients I saw there that were very touching to me. This girl here, David and Helen had met the day prior on a home visit. We would do home visits to visit HIV patients that were too sick to be able to leave the home, and they visited the home of this young lady, and her family was preparing for her to die. They knew that she was end stage. They knew that her situation was incurable and she was losing so much weight that they figured that she would be dead within a day or two. We had asked them to come into the hospital, but the family said, we cannot afford to do that. And so Helen and David left with heavy hearts, but we were surprised to see that her family had brought her in overnight, and she was in the bed, and we got to work feeding her this tube around her ears called a nasogastric tube, and we were feeding her through this tube. And then we shot a chest x-ray and saw that her chest x-ray was filled with miliary tuberculosis, which is a very common finding there. And she had disease everywhere from head to toe. It was thin, but we all had hopes of saving her, and she did so well and started to come around until 3 days later she unfortunately succumbed to her disease. This is Samson, one of my favorite patients. This is a 13-year-old boy. He had a headache, and his parents had taken him to a witch doctor because they believed that the traditional medicine would kill him. It's hard to see here, but he actually has a cut on his head, these 3 cuts on his head, where the witch doctor did some sort of surgery on him. And we don't know what it was. But he developed this enormous lump on his head that was an infection, an abscess. And here I am, we put a needle in this abscess and just got out infection and pus. I eventually had to take this kid to the operating room and put him under general anesthesia to do this drainage. And afterwards, he felt much better. And I thought, you know, this was a success, but he ended up coming back to us about a week later with seizures, and his vision was getting very poor. So he ended up getting transferred to the government hospital for a CT, and there isn't a night that I hope that he's doing okay and pray for him. The children in Kenya are just so beautiful, and you can never, ever really be truly depressed or disappointed when you see their faces. I mean, these were my neighbors. They were always playing in the yard. And I was lucky enough to get a chance to do work at the orphan program as well. I don't know if you guys can see me in here. And we would teach them mathematics. I actually got to teach an 8th grade class while I was there about HIV, and it was just an amazing experience. And getting to do home visits with Praxides, who is a medical worker that we have, who herself is HIV positive, and brought herself from the brink of death through faith in God and seeking help from others when she was so prideful that she decided one day just to give her life to God, and God told her to get treatment. And she has turned her life around, and now she spends countless days going around and giving those who have lost hope, going to their homes and telling them that you do not have to die from this disease. And this woman, the woman right here that you see on the right, she has 5 children. She lives in a shack. Thankfully, none of her children are HIV positive, but her husband only comes home at night. He beats her. I mean, it was just such a terrible situation, but there was still this hope. And so many times I spent nights thinking, how can people have hope when everything around them is going wrong? But there's so many good people there that no one ever completely loses hope. And it's just such an important thing. This is their home. And this is really the extent of it. And five people live in this dirt-covered floor, a tin roof filled with holes. She said, their words, I asked them, what happens when it rains? And Praxedes says, they suffer.